Good Tuesday afternoon. I'm Dr. Martha Buchanan, Senior Director and Public Health Officer here at the Knox County Health Department. Our moment of gratitude today is dedicated to those who are making plans to get their flu shot. We always recommend everyone get a flu vaccine each year, but it's especially important this year. We don't want to have a bad flu season on top of the COVID-19 pandemic. As we mentioned last week, due to the pandemic, we will not be doing our in-school flu vaccination clinics this year. However, we plan several public flu clinics in our community to ensure that folks have an opportunity to get their vaccine. What makes this opportunity great is that parents and family members can get their flu vaccine at the same time as their student. The first 5 clinics have been posted on our website and are available to anyone in the community. No appointments are necessary, and we'll be following all COVID-19 safety precautions, so be sure and wear your mask. If none of those opportunities work in your schedule, you're welcome to call our main location or our West Clinic to set up an appointment for a flu vaccine. The phone numbers are listed on our website. Our real-life example of putting the 5 core actions into play is scheduling a playdate. We know socializing and interacting with other kids can be healthy for children to connect and play. However, it's important to do this safely. If possible, set up the playdate outdoors where it's easier for the kids and parents to participate safer and in safer, less contact activities such as chalk or frisbee. Parents can do some chalk and frisbee too if they want to. If your children are less than 2 years old, they should not be wearing a mask. Remind your kids the importance of washing their hands frequently, especially before and after eating, and encourage parents to model those behaviors, wearing their mask and social distancing and washing their hands regularly. And as always, if your child isn't feeling well or has been exposed to COVID-19, keep them home. Those are just a few simple tips that can protect you and those around you while you're still going about your life. Before we get into the local situation, we want to spend a few minutes talking about misinformation. The volume of misinformation out there is staggering. It is imperative that the information you are consuming and sharing is accurate. As we know, misinformation can be crippling and dangerous and seems to spread much more quickly than actual facts. That said, we encourage everyone to get their information from reputable sources. These are places like here at KCHD, the Tennessee Department of Health, or your physician. So please take the initiative to ensure you're getting your facts from trusted sources. Now we'll move on to the local situation. We have 59 new confirmed cases since yesterday's report, giving us 9,285 confirmed cases of COVID since March. Additionally, we have 407 probable cases. 7,786 of our cases are considered inactive, giving us 1,830 active cases. 343 individuals have been hospitalized at some point in their illness. Currently, we have 29 Knox County residents hospitalized. Unfortunately, we have 3 additional deaths to report today, bringing our total to 76. We want to spend a few minutes clarifying our probable case count. As a reminder, the probable case definition can be found on Tennessee Department of Health's website. But in layman's terms, it means someone displaying COVID-19 symptoms who is a close contact of a confirmed case, but that hasn't been tested. You can also be a probable case if you have a positive antigen test. The full case definition for probable cases can be found again on Tennessee Department of Health's website. We've received several questions about why the probable case count continues to grow. The probable case count on our website is a cumulative count of probable cases, and as such, will continue to increase as more probable cases are identified. This is similar to our confirmed case section on the chart. While other counts on our website, inactive and active, will ebb and flow as cases roll on and off, the probable and confirmed case counts will only increase as new cases are identified. The only time a probable case would be removed from this data set would be that if they get tested and they become a positive case. Then they would be moved into the confirmed case section on the data page, but they will not be counted twice They're in one category or the other. Now I'll open it up for questions.
All right, type your questions into the chat box. The first question we have is from Jeff with WATE. How is the expanded curfew working? Did you have complaints over the weekend or any enforcement actions?
I'm not aware of any complaints and I'm not aware of any enforcement actions, but it's only just begun.
From Cole with WBIR, regarding the 10-minute exposure rule, if you are within 6 feet of someone for 9 minutes, can you still get the virus, or does it have to be 10 minutes?
So we changed a couple of weeks ago to a total of 15 minutes of exposure. And so per the Tennessee Department of Health, so it's now within 6 feet for 15 minutes or more, and it's continuous exposure, not episodes of exposure.
From Vincent with the Sentinel, we have seen 7 deaths over the past 7 days. We are within spitting distance of surpassing August in terms of mortality. Can you speak to why this may be?
You know, it's a great question for our hospital partners. We don't care for the patients, don't have any clinical information on them. I think it's really unfortunate. It speaks to the fact that this virus is a deadly virus. It's a lethal virus and it can take lives, and it does. And it's very unfortunate. And, you know, we've heard medical professionals say that unlike flu, this virus really is much more aggressive, and we see deaths with this virus in larger numbers than we do with flu.
Cole with WBIR, he says, adjusting his previous question, can you get the virus if you spend 14 minutes in close contact with someone, or does it have to be 15 minutes for the virus to infect someone?
You know, the science shows that you need to have 15 minutes or more of continuous exposure. And Charity's writing me a note, sorry.
Yeah, it's the quality of contact though too. If you're in, you know.
Right, it's also,
kissing
so,
somebody for
right.
5 minutes.
Right. So it's the type of contact that you have with that person. So if you're having a conversation with that person and you're not, you know, right up in their face, in their personal space, it's less risk than if you're right up in their face, or perhaps you're kissing them, or you're living in the same household with them and you're constantly interchanging space with that person. That increases your risk. So I know people want to say, oh, it's only been 14 minutes, so I don't have to worry. And for the most part, that's true. But we really want people to be conscientious about exposure and trying to maintain that 6 feet of distance and keep your mask on. One thing that's important, if you have 6 feet if you're less than 6 feet from somebody for more than 15 minutes, even if you're both wearing masks, the Tennessee Department of Health has consistently ruled that is considered a close contact. So you might say, why would I wear a mask then? Well, it reduces your risk. It doesn't eliminate it, so we consider that a close contact, but it reduces your risk so that it's less likely that either one of you the other one would get the virus. Also, to their point, we certainly see lots of people wearing their mask incorrectly. It's not a chin strap. It goes over your nose. It doesn't just go over your mouth. So lots of differences in how people are wearing their mask and impacting their effectiveness.
From Vincent with the Sentinel, we are often told that deaths are a lagging indicator of case growth. Does this level of mortality correspond to the spike in cases we saw earlier this month?
Yeah, I think it does. You know, we saw some of our highest case counts couple earlier this month or last month. And so certainly we would expect to see some deaths as a result from that.
From Jeff with WATE, can you clarify the change in the CDC guidance on droplets/aerosols? I'm not so much concerned with the decision to reveal/not reveal the guidance, more about what does the science say?
Well, what we know about this virus is that it's spread through droplets, big droplets and probably small droplets. I think the exact science about the small droplets there's still a little bit more to learn about that. But when they talk about the small droplets, it's really inside poorly ventilated areas, close contact kind of places where people spend a lot of time. So I think that's what they're seeing. I think there's more to come. I think what people need to know is that this virus still, how you get the virus hasn't changed. You breathe this virus in. So wearing a mask, you breathe it out, you breathe it in. Wearing a mask is very important. Maintaining at least 6 feet of distance is important. Washing your hands regularly, cleaning surfaces is important because you can pick it up off of a surface. That's not the main way it's transmitted. And then also staying home if you're sick or if you've been told to stay home because you're a contact. All of those things will reduce risk. I think we have some more to learn. The data seems to be pointing towards some possible aerosol spread, but really it doesn't change what everybody needs to do every day. Wear your mask, maintain physical social distancing, whatever you want to call it. Those things we know work, and those things reduce risk.
From Claire with WUOT, why do you think the active case numbers are dropping at UT? Would you attribute this more to a decrease in transmission or a decrease in testing?
I'm not sure if we have that information. Yeah, probably a little bit of both. We do know that some university students are choosing not to get tested or trying to get tested outside Knox County, doing other things. We're aware of that. But also, perhaps the increase in cases and some of the messaging from us and from Chancellor Plowman have convinced students that they need to do things differently. I also know that the university is very aggressively contact tracing and putting people in quarantine, which we know is a method that works well. It's what we do all the time.
Vincent with the Sentinel, in terms of morbidity, if we closely follow the 7-day or 14-day new case growth averages for the remainder of the month, we will surpass August and possibly July in terms of cases in September. What might this mean for the county?
I think what it means is that we need to all really be diligent about following the 5 core actions. I think that's the only thing that we can do as individuals that's going to impact our lives and the lives of people around us. Certainly, we don't want to continue on that trend. We hope that changes, but that's really up to everybody out there choosing to follow the 5 core actions all the time. Whether you're hanging out with friends, whether you're out at work, whatever you're doing when you're at school, everybody's got to follow the 5 core actions, and we know that's what's going to help bring cases down and reduce risk.
From Cole with WBIR, does KCHD believe the mask mandate has helped stop the spread at all in Knox County?
Absolutely. I think the data really reflects that. And mask mandate went in place July 3rd or so, and 2-3 weeks later, we saw our case counts going down. Then we had a change. School students went back to school. UT students came back to town. So we saw some changes and some uptick in cases. We're hoping that we'll see those trend down in the near future, but it is not a reason to stop wearing your mask or stop social distancing. All of those things are very important and will continue to be important for quite some time.
Also from Cole with WBIR, we're now 2 weeks out from Labor Day. Has KCHD seen the spike in cases you expected?
I'm looking at Charity. I'm sorry.
Not yet.
No, we haven't seen that yet. So maybe we won't see one. Yeah, hopefully not.
From Jeff with WATE, there seems to be a trend of deaths in late middle age. The 45 to 64 age group has nearly as many deaths as the 65 to 74 group. Can you offer any potential explanation about this particular group?
Well, I think what we know about COVID deaths is that people with chronic illnesses tend to have more complications. And we've also honestly just seen an increase in cases in that age group to go along with those deaths. So if you have more cases in an age group, you're going to have more deaths in that age group.
From Cole with WBIR, are you seeing some age groups where the amount of tests being conducted is declining faster than others?
Yeah, we don't really track testing by age group. So we can maybe look at that. I'm not going to promise because it might be a bigger data dive than we can do right now.
From Vincent with the Sentinel, I have follow-up questions for your hospital partners. Where might I direct them since you cannot speak for them?
All the hospitals have public information officers, and you should know who those are. So you can reach out to those folks.
From Jeff with WATE, UT is moving to more systematic testing, including wastewater and group saliva testing.
Mm-hmm.
Oak Ridge announced some wastewater testing. What is KCHD doing when it comes to systematic testing?
We are not doing any pooled testing. Some of our utilities are doing wastewater testing. However, one of the challenges with that is that it's a large geographic area, not like UT's wastewater testing will be like dorm A, dorm B. We don't have it quite that specific. So it's not, we honestly haven't really figured out how to use that information in any way in the larger community. But those isolated ways to do it are very helpful.
From Vincent with the Sentinel, what does reporting the active case count, but not the number of tests or new case growth as UT does leave out? Without either metric, it is difficult to interpret. Do you have any advice for people following the university
It's
stats?
a great question for UT. Oh,
From Cole with WBIR, what happens if a UT student who lives in a dorm, for example, gets tested outside of Knox County? If a student doesn't notify, does Knox County find out about that case, or does UT?
we do. That's the short answer. So it's what we do all the time. People who live in Knox County get tested for something else somewhere in a different place, or they get sick while they're out on vacation. They come back here. So that person gets counted as a case in Knox County. It might go to their home address, the health department there, and then come back to us. Or it might go to the State Department of Health and come back to us. But we do eventually get that information. We would encourage UT students who feel like they need to be tested to get tested in Knox County. It does speed up us getting that information and is helpful in helping reduce risk on campus.
From Vincent with the Sentinel, KCHD has clearly been working closely with the UT Medical Center medical director, and he has spoken on behalf of your hospital partners in the past as a group. Will he be made available to answer questions?
We're working on scheduling that.
From Cole with WBIR, Nashville released information including locations of clusters in the community. Will KCHD, why or why not?
At this time, we have no plans to release any information about locations of clusters. And the reason for that is that there are no particular places you can go that are higher risk for COVID-19 than other places in the community. Everywhere you go, you're at risk of getting COVID-19. Obviously, there are riskier behaviors. You know, if you're going to a crowded place inside where people are not wearing masks and you can't maintain social distancing, that's a riskier behavior than being at the park outside where people can maintain social distancing. So really, everybody all the time needs to act like they could potentially get COVID-19 throughout their day. So that means following the 5 core actions. I know I'm a broken record, but that's what's going to make the difference in our community. And that's what every citizen can choose to do to make a difference in our community.
All right, any other questions? Please go ahead and type them in now. From Vincent with the Sentinel, do riskier behaviors correspond with particular locations where riskier behaviors might occur?
You know what? Risky behaviors can happen anywhere. Risky behaviors can happen in a house. Risky behaviors can happen at a restaurant. They can happen at a store. They can happen at work. We've seen that happen everywhere. We've seen clusters in places of employment where the people decide to take their mask off to eat lunch, and then one of them gets COVID and the others get COVID. We've seen it at showers in a personal home where somebody goes and they have COVID and other people get COVID. It's going to happen anywhere. It's where people let their guard down and aren't following the 5 core actions because it feels awkward or weird. I don't want to go to my friend's house and wear a mask. I don't want to go to the shower and be the only one in a mask. How weird is that? And how awkward is that? So people need to continue to make good choices and make that awkward choice to say, I'm going to wear a mask to protect those around me.
From Cole with WBIR, as the county's public health director, what do you think of the Knox County Commission's discussion about shifting some regulatory power away from the Board of Health?
I think it's all new information. I got to read the resolution this morning for the first time. And, you know, it's concerning. I think that we'll have to see what the commission decides to do. I know that the Board of Health and the commission both really want to do the right thing for the community. They have different ideas about what that looks like. You know, I trust the Board of Health's expertise. I trust my staff's expertise and our years of experience in controlling infections on a much smaller scale than COVID. But I also understand that people are concerned about the direction that this has taken, and I'll be curious to see how they vote. Obviously, it will impact the work that not really impact the work that we do every day, impact the work we do with the Board of Health.
Cole says, sorry to follow up. Can you expand on why you think it's concerning?
I just think that the possibilities of, you know, it's established. The Board of Health is a set of health experts, and they have the expertise to make those decisions. To put that decision-making power in another body where they don't have that expertise can be challenging. And this is a long time. And also, I worry about the long-term effects on how the Board of Health would operate. going into the future. So I'm not sure what that would look like. So I think there's just a lot of ripple effects we have to think about, and taking that decision-making ability away from the people with the expertise, including myself and my team who practice public health every day in this community, protecting all of you from different things, keeping, a few cases of measles as a few cases of measles and not becoming a whole outbreak of measles in the whole community, keeping an outbreak in a nursing home to one wing of that nursing home, or being able to work with a daycare and keep those cases of whatever GI illness it is in that one classroom and not spreading throughout the whole daycare. We do this on a much smaller scale every day. We've been doing it for years. Taking that away from the folks who have the expertise is concerning.
All right, any other questions? Please go ahead and submit them now. All right, not seeing any other questions come in, so thank you all for your time, and we will see you again on Thursday at 12:30. Have a good rest of your day.